Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our Children Health Awareness series, we have Dr. Ashish Jaiswal with us. Dr. Ashish is a consultant neonatologist and pediatrician at Super Specialty Baby Clinic, Motherhood Hospital, Indore. For the past 20 years, he has been working in this field. Welcome to Medicircle, Dr. Ashish Jaiswal.
Thank you, Rasi.
So, every year, an estimated 15 million babies are born preterm. Preterm birth complications are leading cause of death among children under the age of 5, responsible for approximately 1 million deaths. 3/4 of these deaths could be prevented with current cost-effective interventions. Across the country, the rate of preterm birth ranges from 5% to 18% of babies born. So, doctor, could you please tell us what do you mean by low birth weight babies or premature babies?
Basically, low birth weight babies are babies which are born less than the average birth weight. Classically, the most of the babies' average birth weight is around 3 to 3.25 kg, and any baby who is born less than 2.5 kg, we call them as low birth weight babies. And of these low birth weight babies, those who are born less than 1 to 1.5 kg, we call them very low birth weight babies. And if they are born less than 1 kg, we call them extremely low birth weight babies. Similarly, for prematurity, preterm, expected date for delivery for is around, it should be called 40 weeks. And from 37 to 40 weeks, we call them term babies. And any baby who is born before 37 weeks is called preterm baby. Similarly, in preterm also, we have the babies who are moderate preterm, late preterm, and severe preterm. And babies who are born less than 28 weeks are called extreme preterm babies.
So, what causes premature labor?
There are various causes of premature labor ranging from the genetic to the environmental factor, including infection. But most of time, exact cause of the labor, preterm labor, could not be identified before. But those women who are having a preterm labor in their previous pregnancy will have increased risk of preterm labor in next pregnancy also. And infection also predisposed for the increased preterm labor.
So, how do you treat premature babies?
See, as I said, all premature babies are not same. The babies who are more premature, most premature, are the babies who are more critical to be requirement of the care. So babies who are born less than 28 weeks, the babies who are born between 28 to 32 weeks are the babies who require more care, and babies who are born after 34 to 36 weeks, babies are usually required less intensive care. So we usually admit these babies who are less than 28 to 32 weeks at the time of birth. We attend them and we resuscitate them. They need help in the breathing. Then we admit them and keep them in NICU. Based on the weight, if the babies are extreme preterm, they might keep in the incubator also. And the average babies are kept in the open care system. Incubator is a closed care system, and there is an open care warmer system. These are both, they are inside the neonatal intensive care units. Then they need all kind of support for their organs, because basically what is happening in preterm babies, their organs are developed. Their organs are made, but they are not fully developed. They are not fully functional. So we help them in the breathe. We help them by putting them either on the oxygen or respiratory support in the form of CPAP or ventilation, because baby can't feed, so we might need to feed them through the tube feeding, or if their intestine are not enough mature, we need to give them the parenteral nutrition, which is given through the intravenous route in the form of injections. So this is the most babies required. Then if the babies have infection, we treat them with the antibiotics. And we give them a kind of environment which is there inside the mother's womb. So basically it is called developmental supportive care. So we want to develop the baby in a way that they are inside the womb by keeping them with all these kind of supports.
Yes, doctor. So, like, what kind of health problems do premature babies are likely to have?
Yes, the health problem of premature babies is very, very specific and entirely different from the term baby and other grown-up babies or adults. Okay, so because as we said, the babies are born premature, they need support. So most important problem comes with the breathing. They have the typical disease called the respiratory distress syndrome or highly membrane disease, which is happened because of the immaturity of lung. So this is very important problem which requires support right beginning from the birth. Then, as I said, babies have a typical problems of the prematurity, like they might have patent ductus arteriosus, they may have intraventricular bleeds in the form of bleed in the brain. As I said, the baby's intestines are not mature enough to feed. So sometimes they may have feed intolerance, which we call also them necrotizing enterocolitis, NEC. So there are these babies are even prone to infections. So entirely all we can say these are the fragile babies which we need to support them. So I was talking about the problems of the preterm babies. So babies who are basically born preterm have the problem of specific organ systems which we need to support.
Okay, doctor. So, how should mothers take care of their premature babies?
So usually mothers needs to take care for their preterm babies. Importantly, in the form of that baby needs extra protection than the term babies. So extra protection is in the form of in to protect them from infection. So it has to be the all the kind of things need to be taken care for these babies to avoid them and prevent them from getting infections. Then thermal, the babies born premature babies, they have entire different thermoregulation system, which keeps are prone them to get hypothermia. So we need to keep them warm by covering them with the layer of the cloths, and even might need to keep them in the warmers also. Then babies need to be frequent feeds. The preterm babies are the babies which the smaller the smaller the baby's stomach capacity. So usually this baby needs to be feed frequently. So we usually say the schedule feeding for these babies, and most of babies might need feed to be every 2 hourly. So these are certain points which a mother should be taken care of for preterm baby, different from the babies who are more mature or term babies.
So, like, can mothers bond with their babies while they are in the neonatal intensive care unit?
Yes, yes. We especially, as I said, now we are focusing on the developmental supportive care. So one of the form of the developmental supportive care is to get a good bonding between the mother and baby. So what we do to there are certain things which we emphasize to increase the bonding. One is called kangaroo mother care. So once the baby is stable, we keep the baby and mother together in the single seat covered with them, like the what the kangaroo does with them with their babies. So that kangaroo mother care increases the mother's bonding because babies are close to their abdomen, touch with them like they are in their womb. Second thing is that we advise the mother to have like talk to their babies. So in that case, sometimes because babies can listen very well, so we sometimes ask the mother to record a few songs or we call loris so that we can put those music to the baby, and that can also help in the mother baby to bond with the mother's voice. So there is good chance that mother will have a emotional bonding and bonding with the baby during an NICU stay also.
Okay, doctor. So on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question answer session in which you can answer in 1 or 2 line sentence. So my first question is, doctor, that are premature babies too weak to be breastfeedden?
Not exactly. Premature babies can also be feed, but they may not be directly breastfeed. We need to express the mother's milk and give them through the tube or a spoon.
So what health problems do premature babies have in later life?
Preterm babies will have a typical kind of things in their later life also. Especially most of them are the physical and mental development wise, neurodevelopment wise, and we usually follow them. So growth and development issues will be there in preterm babies, which needs to be taken care of.
So how long does it take for a premature baby to be a healthy baby?
We usually expect a preterm baby to be around 2 to 3 years to be at par with their term counterparts. So you can say physically most of the babies are like term babies at 2 to 3 years of age.
Okay, doctor, thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you very much. Thanks for your time.